So hello and welcome everyone to Career Shades once again. And today we are here with Dr. Krishna Purohit. She is a cosmetic dentist, has experience over 7 years, and she also does baking as her part-time gig. So ma'am, also tell us that not a lot of people choose this dental profession when it comes to being in this healthcare field. Why is that? Like people prefer being other kind of doctors, but not a dentist. You know, these notions are going around, right? So why is that?
That's
What
right.
made you choose this particular field?
Okay, so I would just like to share a small story. I would just like to brief
Okay.
you up. Is Diksha, I never wanted to become a dentist. Trust me,
Right.
it's not with people, it was also with me. When I was a child, we had a subject called as value education, moral science, and we used to write in big alphabets, what is your aim? I used to write, I wanted to become a doctor. So doctor
Right.
is a very general category. You can't like just become a doctor. You have to be clear, right? But I always used to write, I wanted to become a doctor. And when I grew up, I came in the 10th grade, and that's when I realized, no, I don't want to become a doctor. There's too much of studying that I would have to do. So I want to do hotel management because I had a business background. My father is a hotelier. So I was
Okay.
like, oh, I want to do hotel management. That's good for me. But after I got my results in my 10th grade, I think the results were good enough. They were so loud that I realized, no, I think I should choose science and then let's see how it
Okay.
goes.
Right.
So with 11th and 12th, I did science and I realized that I had that sudden interest in studying zoology, biology, botany, and all of those things. I'm like, that's really interesting, knowing human body, studying and all of that. And then
Right.
while discussing and while getting that awareness, and because I always had that, the creativity in me, I'm also a baker, so I like designing things not only with cakes but also with my house, with my nails, with my hair. I like doing things.
Right.
So I knew that I have that creativity, so dentistry was a good blend for me. I thought that it's just the field that I want to get into. It's a combination of science, and it's also a combination of science with arts, so it
Right.
worked well for me. So which is why dentistry for me. But I'm telling you, it is a notion. People
It
don't want
is.
to
It
get
is.
into dentistry, but I'm telling you, it worked for me because I had it in my head and I was clear later on that I want to get into this.
Right. So
So
for the
yeah.
students who are still feeling that maybe dentist is not something you want to become, would you like to say a word to them?
So I would just like to tell you, just explore yourself, just know yourself. If you know you have the zeal in you to probably, look into each and every patient's mouth and then go back home and eat good food, then I think dentistry is a field for you. Otherwise, you should just, get into becoming a general physician or an ophthalmologist or a gynecologist or any other field.
So, ma'am, a lot of people are reluctant about going to dentist or any other doctor in general. So, when such kind of patients come to you, how do you deal with those patients? How do you just ease them out?
I would just tell you that yes, patients, for example, let me ask you, are you comfortable going to a dentist without any pain? I'm sure you're not, right? Unless you have any pain or anything that's troubling you, you would end up going to a dentist. So I would just like to brief you that it's the awareness that all of us lack. So till
Right.
we have pain, we will not go to the doctor, be it a dentist or be it a general physician or be it any medical profession. Now, if I have a patient who's reluctant to come to me, what I try to do is I just try to develop that rapport with a patient. I would probably address my patient with the name, how are you doing today? I would just like to make them comfortable in my space, and I would actually try to hide all the pokey instruments that the patient would be like, oh, this is going to go in my mouth, and
Right.
they'll just be so scared. So I would probably just like to, hide that from them. I would just like to show the place around. I would just like to have a good aroma in the clinic, a good perfume that's there in the clinic. So that also helps them build a certain kind of comfort. Oh, like, oh, this place is hygienic.
Right.
Oh, it's smelling nice. It's not smelling like the usual clinics where, there's that spirit smell that is all around and all. So
Right.
I
Right.
just try to work on those aspects. So just having that general rapport
Right.
building up, I think just helps for me, at least for me.
Yeah. So, but still,
Yes.
ma'am, was there any particular time where you found it difficult to deal with any patient or any situation?
So it happens, day to day. Like I told you, a patient will come to me only if he has pain. So in case, for example, if I'm doing a complex procedure like a root canal treatment. So root canal treatment is not a single sitting job. I will have to call the patient at least 3 to 4 times. And that's also because, for example, if I'm charging 10,000 for a root canal, they will give me the entire money in installments. So now what happens is, first sitting when I do, patient probably just gives me the amount that they have to pay for the first sitting, and they go back. Now in the first sitting, the pain is gone, and with pain, sometimes the patient is also gone. So that is something that we keep experiencing, like pain gone, patient gone. It's something that happens. So that is something that we face regularly.
Right. So you really have to be consistent and patient with the patients, right?
Yes. Yeah. So in this case, I think my educational, or just giving them a positive approach, like, see, it's very important to do the entire procedure. You can't just let your procedure happen midway. You can't just leave it midway. You have to complete it because it's very important. Otherwise, this will happen, that will happen. So I just try to educate them about the pros and cons of the entire treatment. Each and every patient, just imagine, every patient that comes to me, I have to just explain the same history again and again and again, but I still take that time out and explain it to them, because for me, he must be my 10th patient, but for him, I would probably be his first or second dentist. So it's my duty to explain.
So being optimistic and being patient are some skills that are
100%.
actually required in this field, right? So ma'am, what other skills do you think are required to be in this field? So you have to be optimistic, patient, what else?
Optimistic and patient and all that can also come with your nature, and it can also come with your practice. It can actually come with dealing a lot of patients. But technically thinking, if you want to become a dentist, you have to have that creativity. For example, if you want to get into MBBS is just studying. So you need to have that science knowledge, you need to have that intelligence. But with dentistry, you also need to have your clinical hand, you need to have a soft hand, you have to be painless, so you have to have that creativity in your hand. So this was in the first year that I had studied in dentistry, that dentistry is not just science, but it is art first and science later. So you need to be artistic first, and then you need to have that intelligence. So a blend of these two things together will make you a successful dentist. So that is the main skill that one needs to have.
Wow. I hope my students are hearing all of these tips. So guys, note them down, because these are really going to help you in future.